All right. All right. Can everyone hear me?
Yes, sir. We are hearing you.
All right. When we are putting this class together, we think that to be able to survive in a real work environment, you will need some skills, and then to start your career in software development, irrespective of the technology you want to use, we think you will need some things, and those are the things we'll put together to form this training. So So one of the things that we put together is what we have here. That is project management, introduction to Scrum methodology, and then we are supposed to do an assessment after. So the resources that are supposed to take you this course will not make it to the class. So we're going to shift it to around 11 a.m. tomorrow morning. After the first class, we are going to take it, and then
Saturday.
on Saturday, apologies, on Saturday. So we're going to take it, and then we'll move on. So we plan that we are going to be developing a project that is an hospital management system. So if you look at our environment today, the industry that is not really appreciated is an hospital management system. And then if anybody is spending money on his health, is not happy spending it. It's very rare for you to see somebody going to the hospital, paying a huge amount of money, and then he is happy paying that money. So if we develop an hospital management system, do we can sell it, and then we plan to make it an open source. So at least for you to finish developing an application, you have that particular solution if it's an open source, where it's like a community that build it. Open source means that something is open to everybody and anybody can use it without paying for it. So if you pick the solution and then you see somebody that need the solution and then you're able to sell it to him, whatever you get from the project is your own. So it's going to be an opportunity for you to be able to. But if you don't really contribute or you are not active in the development of a project, you will not be able to benefit from this because you will need others to come and do some things for you, which you will need to pay them for it. So put more effort. And then whenever you want to use the solution, you should tell us so that we'll know that this person is using the solution. And then mind you, any code that you write, any contribution that you made on this project is not your own. It belongs to DevLink. The idea is so that somebody will not sue you in the future and say, it's my code. So it belongs to everybody and it belongs to nobody. So we plan that because the turn up of the people that are participating in the class, it's a bit lower than what we are expecting. And then we plan that we're going to develop 5 modules. That is patient management system, doctor management system, pharmacy management system, laboratory management system, and then billing and finance management system, where people will be able to make payment. Laboratory will take care of lab, and then pharmacy will take care of the drug dispensing and then payment, patient medication record. Doctor management will take care of consultancy, and then patient management will be like an electronic record management system where we'll have all the record, medical history, and all those things there. So there is one thought that came to my mind some years ago. Imagine all the hospitals in Nigeria have a single central medical center or central medical record where all the information of patients are there, irrespective of where you go. And then there's some area or aspect of medicine that it's not yet accepted in Nigeria, or we don't have personnel that will take care of those area. Or there's some medical consultants that comes to Nigeria once in a month, once in 2 months, just to come and do some consultation and then see some patient, not even surgery. And then you wonder if we can have something like a medicine as you go, where people will be able to sign up or subscribe to medical management or medical system, where they pay something at the end of the year or monthly, or it's free, where somebody has a lot of doctors. Let's say we have doctors in Europe, we have doctors in Nigeria, and then we have some doctors all over the world. Let's say your own ailment is something that cannot be taken care of in Nigeria, and then you can log on the system and then talk to somebody that knows about those things. So there are quite a number of people that got sick. They don't need to be in the hospital. They just can make a call, talk to a doctor, and then that's the future of this project. That's what I'm trying to say. So we'll analyze this project and then see what is expected from this project. Along the line, we're going to break the team into four. We can only break the team into four because we don't have much people on the training. So if we had more than the numbers we have, we can break into 5. So it means that it's only 4 modules that we'll be able to develop based on our capacity. The UI UX team will be in 2 or 3 parts, where they will be able to support the front end guys that will be developing the application. So this is what we have here. So because, yes, I'm with you.
Does that mean that you say that we were going to break it into 4 and leaving the billing and financial management? Can't we like merge the all of the group 4 group come combine together and just after they finish their own module, we come combine together and do this final module together?
You are really interested in this project, have you?
No, instead of we leaving it out of the system, can't we like after we finish our own part, then we just come combine together and just face it together?
Remember, we're talking about people that has not done this before, and then you want to do it within 1 month. You know it's going to be too much, and then people are just learning. So we need to just take it slow and then see whatever we are able to do before then, if we are able to finish, and then we can move into that one. But I feel we just need to take it easy, and then from the smaller parts to the bigger parts. But don't worry, once we're able to achieve this, it means that we can do more than this. I don't want to do a typical tech academy that they will just say you go and build a project. I'm trying to preach something, your ability to be able to work in a team, your ability to be able to work independently, and then your ability to contribute without expecting something in return. So that in the future, you will be able to teach people the way you have been taught on how to do this and then contribute to the society at large. I don't know if you understand that.
I understand, sir.
All right. So the patient management system is going to have 3 core functionality. We have patient registration and demographic management, electronic record, EMR and maintenance, and appointment schedule and management, where they will be able to schedule an appointment with the doctor. And then we have doctor management system. Doctor record will be managed there, doctor schedule and availability management, performance tracking and metric, doctor entry patient record. Doctor will be able to enter the patient record after they've attended to them there. And then we have pharmacy management system. And then pharmacy will have inventory management system, where we'll be able to keep the inventory of all the medications we have on the system. And then we have prescription ordering and processing. We have medication dispensing and billing. So if you look at this module, if you are running a pharmacy, It's something that you can use on your own to take care of your system. So if you are running a laboratory, let's say somebody is running a laboratory, it can use this module. So that's the objective, so that if it is an hospital that has the entire team, they can use it as well. So this module, laboratory management system, can be independent, pharmacy management can be independent, doctor management system can be independent, and then patient management can be independent. Are you guys following?
Yes, we are, sir.
All right, so I would like now to ask a question. In an hospital management system, what is the expectation? Can anyone tell me what is it's all about and how they run it? Hello, guys.
Hello, sir.
Mr. Shegun, tell us.
Okay, sir. All right. From my own experience or what I've seen so far, because I've been seeing the system, I mean, the way they run it, you understand?
Can you speak louder? I'm struggling to hear you.
All right. Can you hear me now, sir?
It's better.
Yeah. So what I said is that from what I've seen so far, because I've been from my own this hospital, I think they are using that kind of system. You understand? So what I understand is it's all about getting all the history of the patient, the information about the patient, and then the health issue about the patient. Hello, sir. Can you hear me, sir?
Yeah, I'm listening. I'm listening.
Yes,
You
that is
said
so.
history of the patient.
No, first the information about the patient.
Information. That's the first thing, Abi.
Then first thing, yeah, information about the system,
Information
about the patient.
about patient.
Then the history.
History of the patient.
History pertaining to pertaining to the health of the patient, right?
Medical history, Abi.
Yeah, medical history.
Medical history of the patient. Okay.
Yeah, patient. Then the yeah medication. Medication of the will I say the medication history too? I don't know because
Yeah, medication will
we
be
have
part of medical history.
history, right?
It will be
Okay.
part of medical history.
Yeah, okay.
I think you've
Then,
tried.
okay.
Mr. Abdurrahman, what do you think an hospital management system is all about? Oh, Mr. Bashir want to tell us.
Yes, let me try, sir.
Okay.
Hello, sir.
Yeah, I'm with you.
Okay, let me try.
We are listening. I think he has gone, right? All right, who else wants to try? Am I talking to myself, or is only me and Mr. Emmanuel that's on this call?
So I just joined. I don't know if you can help us with a little recap, please, so we can know what you're talking about.
You are late to the party. We finished the rice.
Sorry, please.
Now,
Thank you.
will go give me. All right, so let me recap. If
Hello,
somebody
sir.
else come, I will keep recapping. Just listen, and then you
sir.
know what we are saying. I'm listening, Mr. Bashir.
Okay, sir. Yes, I think it's all about digitalizing the health sector. You know, before now, or let's say before now, like the health records are being kept in folders, like the history about the patient, everything relating to the patient patients is being kept inside folders. So it's all about trying to digitalize it, whereby every health practitioners will communicate in one line.
Okay. I
So
think I
starting
agree
from
with
the
that.
records.
Yeah, I agree with
Starting
that.
from
I'm listening.
okay, so starting from the records. So as patients are coming in, they go through the records where their information will be collected and they register the information in the EMR. So they will be issued a number to go and make payment. They'll go to the account. The number will be used to communicate all around the hospital. So this number, the account will collect and also log into the EMR and transact the payment. So from there, the record will now direct them to the doctor through the EMR as well. So to the pharmacy, to the lab. So every information will be within the EMR.
My network.
Hello, sir. Can you hear me?
Yeah, I can hear you. I can hear you. I'm capturing your thoughts.
Okay, so like managing the patient health under a single communication.
Yeah, I get it. So it's much more like digitalizing. That's what you said the other time,
Okay.
right?
Yes, sir.
Okay, okay. So who else has an idea of what an hospital management system is?
Hello, sir.
Somebody's talking.
Okay.
I'm listening.
Okay, it's just like the last speaker said. I think it's just like a system that brings all
You are not clear.
providers together. Okay, can you hear me now?
Yeah, I can hear you.
Okay, I said just like the last speaker said, it's a system that brings all the healthcare providers together under a single system so that it will facilitate interaction between all the parties that are involved in providing healthcare to the patient. This can result in like an efficient service. So it encompasses both different parties and it involves the patient registration, appointments, management of staff, lab management, and everything.
Okay, that's another good response. So most time when you have, it's clear that we want to digitalize a kind of health system, or let's say an hospital, for example. We're trying to digitalize the process they had in that particular hospital. So one of the things that you look at when you have a problem or you have a requirement like that, it could not, in the future, you might be faced with some other requirements like, okay, I have a school management system. I need a school management system. I run a factory that produces something. Those requests will come to you. And then that's where I'm taking this class so that you'll be able to analyze and understand what the requirement is and then how to analyze or how to put it together to make it a functional requirement. So there are quite a number of tools that you can use to do this. But for me, I like taking it in a very simple way. The first thing I do is to identify the actors in the problem I want to solve. Actor could be the roles on the problem I'm trying to solve. So if I ask you, who are the actors in an hospital management system? Can we all give me one actors in an hospital management system? If you have one, just raise up your hand, I will call you. If you don't raise up your hand in time, that means they will mention what you wanted to mention. So, Mr. Oyedade, number one.
The admin.
Bashir, number two.
The
My name was
record,
all
health
before
record.
Engineer Bashir.
Damblola, number three. You said?
My name was all before Mr. Bashir. I don't know why.
You clap. You didn't raise up your hand. You clap.
Oh, sorry.
No, Mr. Bashir is number three. Who is going to be number four? Mr. Johnson is number 4. Abdullah number 5. Tiwa number 6. Please raise up your hand now so that I will know you are with me. I'm on number 6. I will assume the rest are not in class. They are just Ridwan number 7, Mohammed number 8. Oh, Hikem is not in the class. In case you are talking, we can't hear you, Hikem. All right, I only have 8 people in the class. All right, so let's go. Number 1, can you tell me the actors you know? The actor you know. Just mention one and then we'll call somebody else to mention the rest. Tell me. Mr. Bashir, you are number 1 now.
The health record officers.
Health record officer. Officer. Okay. All right, you can put your hand down once okay, I will do that for you. All right, Mr. Damilola, can you tell us an actor in the health sector?
The patients themselves.
Sir?
The patients themselves.
Yeah, patient. Okay. Mr. Johnson, number 3, can you give us one?
Yes. Medical laboratory scientist.
Lab scientist. All right, so number 4.
The doctor yourself, doctor.
Doctor.
Yes.
All right, thank you. Can you put your hand down once you've answered? Medical doctor. Medical doctor. All right, number 5. Mr. Elsie, you've talked now.
I'm sorry.
All right, T1, can you tell us?
The lab attendants, like medical lab as a scientist.
Somebody has mentioned it. Yeah, tell us another one.
Really? I'm not sure. The lab technicians.
Lab, is it different from lab attendants?
Yes, it's just like having pharmacists and pharmacy technicians.
Okay. Lab what?
Lab technicians.
Technicians. All right. Thank you. Ridwan, can you tell us your own?
Pharmacist.
Sir?
I said pharmacist.
Okay, pharmacist. You take my spelling like that. All right, so Inkem, tell us. Inkem now.
The speaker is misbehaving.
Farouk, what are you saying now? Inkem, are you there?
She has dropped message for you. She said our speaker is misbehaving.
My speaker is okay, it's working now.
Yeah,
I've been
you
talking
now.
Sorry.
Radiography. Thank you.
Yes, those that do x-rays.
Are they not in the lab too?
No, they are not.
Those that do what?
The radiography, are they not in the lab too?
No, they are not.
They are not. It's
Hey,
a different.
I'm building a very massive application here. Hey, they go hear what?
They are different.
Mr. Ikem, do you have more for us?
And I cannot think of any now.
Okay.
Oh, we didn't even put nurses now. We didn't put nurses, did we?
Nurses.
Yeah,
Okay. We've not mentioned nurses. Mr. Ayodele, do you still have another one for us?
Yes, sir. Accountants.
Accountants.
Hmm.
Correct. Any other one?
And the ICT.
The what?
ICT.
ICT. Why? What is ICT doing in hospital?
They
Maybe
are
They are
working,
there.
sir.
Yeah,
maybe the
there.
maybe the
Yeah,
admin, super admin.
Superman. Abi? All right. Do you still think there's any other actors that we need to add here that have not had it?
The radiologist, the radiographer you wrote, sir, I think they are called radiologists.
There are some other people at ECG. They read
Let's
that.
call them
Radiologist.
radiology or radiographer now.
Okay, okay, no
Okay,
problem.
So,
Sir, what about the mortuary people?
now wow. Me, I was thinking we will not get there.
Now we are there.
Is it
Mortuary
mortician?
attendant or mortuary
attendant.
staff.
Mortician. So.
Eh?
Mog.
Morticians, like
Mortician.
MORTICIAN.
English no reach down.
Mortician.
No, remove the G. Remove the G.
Okay.
Mortician.
Mortician. Okay. All right. Is there another one that I've not mentioned?
Think along the line, some more will unfold.
Don't let
Abbas,
more-
what about
Yes?
store?
Ajay, we can hear you.
I said, what about store?
Store.
You know, medical
Yeah, for
supply.
inventory, yes. Supply.
Yes.
Yeah, store.
Yeah, under pharmacy, all those.
And
Is
then
it
normally,
procurement? Abi?
Storekeeper, Abi?
yes,
Yes, we can
storekeeper.
call them storekeeper.
Storekeeper
No, we get auditors.
for store inventory.
Storekeeper,
Yeah, auditors.
inventory manager, Abi?
Yeah,
Auditors.
something like that. Or auditors or manager, whatever.
Now, they are different from auditors. Though.
Then we have
They're
auditors. We
different
should
from
have
auditors.
auditors.
Sir,
We still have
can you
auditors.
include physiotherapists
We
too?
should have auditors.
Someone I felt
Yeah.
like
Auditors are with the accountant.
Therapists, yeah, right. Therapists is part of it.
Physiotherapists.
physiotherapy.
Gynae.
They are doctors.
They are doctors now.
Yeah, doctors.
Not doctors. Okay.
What of cleaners
They cannot use it.
and securities?
They cannot use it.
At some point, security.
Auditors. We need auditors for this place. Oh.
Hey, we need auditors. So let's put auditors.
Auditors are under accountants.
No.
No, they are
No,
not.
they
they
will
are
audit
their
their,
own.
they
Independent,
will audit
though.
the accountant and whatever the
They are
store
independent.
They don't
body.
like accountants. Auditors don't
They
like
don't like
accountants.
How
about drivers?
What of the non I don't know how to put
Non-medical
them,
staff.
non something staff like that. Non-medical
those are
staff.
the-
How do you put it?
And those are not
Those are
something staffs now. Auditors,
Those are the
accountants.
security that they are mentioning.
Yes, they should also have a particular place to know. They should have a
About
particular place
drivers?
to talk about their affairs and the likes.
You want us to put drivers?
They will be in
Very
charge.
important.
Driver, cleaners, all of them, they can be one.
Let's stop there. Let's stop here.
Those ones,
Don't let
those
us put
ones don't
driver
need
cleaners.
access to the information system now.
Okay.
Don't let us
They
put
have
them
no
on the
business.
system.
Those ones they don't use computers.
They don't use.
Yeah,
They don't have any business with the system.
All right. So let's say we've mentioned all the actors. Is there anyone that is missing? There is one that is missing. Should I say it or you will pay fine?
The executives, but Abbas,
Yeah,
what about the
that's
hospital
the people that are
management?
missing. The executive
Yeah,
or head of
executive.
medical department.
Yeah, those ones.
We can have head of department. head of department, and then there is another, the person that controls the entire hospital. They call it
MD.
CMD.
Medical officer. Chief
Chief
medical.
Medical Officer. Yeah.
CMD, that's the executive.
CMD.
That's chief medical.
Hey, the application is going to be big. I'm scared. I didn't spell this chief very well. All right, so we have the Chief Medical Officer. Is there any other one that we are missing? Can we think about it before we go to the next stage? Do you think we'll capture it all?
What of the electrical department?
That is what I want to say, but
that's works.
Works department.
Okay, works. Okay.
Hey,
But I don't know.
Works department. We are building for federal government. All right, this is a very comprehensive list of actors. So most time, when they give you a requirement to develop a solution, the first thing you need to identify is who are the actors. And then when you're able to identify the actors, you will now be asking them, what would they be doing on the system? So what they will be doing on the system will form your functional requirements or software features. Do you understand?
Yes.
So at this point, I will take this particular record into a mind map and then show you how we can analyze this further. But before I go, do we have any UI UX person here? If you are here, please raise up your hand. Do we have any person that puts in for UI UX on this call?
Yes, I am UI UX.
Okay. So most of the features that we'll be building will be designed by the UI UX. They are the one that will put a visual to our imagination so that we'll be able to see it like the way it's supposed to be. So as we are saying, these are the roles that we have. I'm going to bring up a mind mapper here. All right, I can see your hand. I'm going to bring a mind mapper here and show you how we do it most time. Let me look for a mind map. There is one online that we use most time. I'm looking for it.
It's called Myro.
Yeah. All right, this is Myro. Myro is a tool that we can use to do mind mapping. And then if I go to this home page, sometimes they will suggest a kind of sample for you. So if I go to this page and I say that I want to do mind map, it's going to say a lot of idea. It's new font. I want you to suggest something so that I will explain how it works before we start. All right, so let's say this is what we want to do. And then it's going to tell us that, okay, I'm now going to use the actors to be the child of the problem. So for example, I'm talking about an hospital management system. And then who are the actors that I will be dealing with in an hospital management system? I will list them here. And then what they will be doing, I will put it as their own child on this tree form of diagram. Let me take hospital health record, hospital health record, for example. What would an hospital health record manager be doing? So I go here and I'm putting health record manager. But before I do that, let me put all other roles that we've identified. Can you please mute yourself if you are not talking? All right, so I have the patient. I have the patient, lab attendants, all these guys. Let me see if I can bring all at the same time. Yeah, put it here. Put them all here. Copy this. Lab scientists. Oh, mistakenly copied it. I have medical doctor. And then I can add more to this. Lab attendant, lab technicians. I can add more. Pharmacists. Add more to this. Radiologists. Are you getting what I'm trying to do?
So, yes.
Can you see the entire screen?
Yes, sir.
So,
All right, so I have the chief medical officer here. And then I have the works here. So we can remove the numbers there so that it won't be confusing somebody else that will be seeing this document in the future. I didn't spell this pharmacy very well. Pharmacists. I have the nurses. All right, so I'm going to share each and every one of these rows with us. I'll give us numbers, and then you will tell me the function each and every one of them does. I'll give you like 15 minutes to think it out. I'll give you, let's say 10 minutes to think it out. And then you tell me what they do. You can Google it if you have chance to Google it. So you tell me what each and every one of them does in an hospital environment. So assuming you are in a requirement session that you are preparing or you are gathering a requirement. So that's one of the parts of part of the software life cycle, and that's requirement gathering. So you tell me what each and every one of them does. I'm going to assign the functionality to everybody. So you think it, I'll call you, you just tell me what they do. Participants. All right, please, if I mention your name, just note what I assigned to you. Are you guys with me?
yes, sir.
Yes, sir.
All right.
Yes.
I'm going to assign, we have how many people on the call? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. And we have 16 functionality here. I'm going to assign health medical record to Bashir, patient to Johnson, lab scientist to Habib, medical record to Damilola. Pharmacy to INE. Mohammed will do radiography and radiology. Ikem will do nurses. Oyetade will do accountant. Friedman will do ICT. He will do mortician. Umu Khaira will do storekeeper and inventory management. And Zainab will do auditor. So I will look for the rest. I'm giving you 10 minutes to think about what they do in an hospital settings, and then we'll list it on our requirements as we continue gathering our requirements. I will ask you again by 5:10. Please, maybe you should take a paper and a pen and write it down so that you won't miss it. You can Google it, you can research, you can call a friend. See you again in the next 10 minutes. Thank you.
We use 50-50.
Option.
250.
Hello, sir.
Hello, guys.
Yes, I'm true. I'm true, sir.
Yeah, okay. So who is doing medical health officer? Can you tell us what a medical health officer does?
It's Bashir, sir.
Yeah, tell me.
Okay. Like the health record officers, they ensure proper patient medical records.
So we say that take and maintain
Proper patient medical record.
take and maintain medical record.
Records,
So
yes.
it will be much more like an action that you record in a requirement document. So what will he be doing? The medical record officer will be taking and maintaining the medical record. Do you understand?
Yes, sir.
All right. So if we say they take and maintain medical record, what are the records that they will be taking? And then we can add those records here. For example, they need the full name. They need the age and gender of that particular patient. They need age. For age, or let me say age or date of birth. They also need gender of that particular person. They need the blood group. They need genotype. They need genotype. What else do you think they need?
What about the patient?
Next of kin, house address.
Next of kin is NOK. They need house address.
Patient phone number and email.
Then next of kin or next of kin, they need NOK phone number.
Yes, sir.
NOK phone number. What else do they need? They need NOK name. What relationship do they have with the patient?
Yes.
Are you guys following me?
Yes, sir.
Yes, sir.
Yeah, so when you are collecting a requirement, those are the things you pay attention to. All right, tell me other things that.
What about the pictures?
Sir?
Picture, I mean, passport, photograph.
Okay,
pictures.
passport photograph. Passport. Photograph. All right. Is there another thing that you think we need to add in a medical record?
Yeah,
We need to know whether that person has a disability.
okay.
Yes, sir. There's another, well, I don't know, because in some federal hospital, they will ask if you are under in this health insurance scheme.
NHIS.
NHIS.
All right. So
Or you want to be a private.
NHIS, we can have it too. Medical insurance, medical
Health insurance.
insurance. And then the name of the medical insurance. Name of the HMO. And then if you have the name of the HMO, you have the number
Yes, sir.
of the HMO.
HMO, yeah.
That's the patient's number of the HMO. Patient's number of the HMO. Which other things do you think we need to capture? For a patient. Are you guys with me? Or we are just
Yes.
we are here?
What about the dependent?
Abbas,
Ma?
Abbas, at this stage, is it just the biodata we're collecting?
Yes,
Oh.
we are talking about health record officer. And what does it do? It take and maintain medical record of the patient. So what are the records that we are capturing for a patient? And then that's why we are talking about these things. So
Okay.
we are looking for more. If you have, we can add to it. So what are the things that we need to know? Sometimes they will ask you, what are the common ailments that you have? Whether the person is diabetes, we can have lists of common.
Yeah, that was why I was asking Abbas.
That's why
Because this information, this is the first stage. Let's say when you come for registration.
Yes.
These are the things I'll ask you, but there are other fields that a medical doctor too will need to input. You understand? When he's seeing the patient.
We have not gotten there. We have
not gotten there.
medical record officer. The first person you meet when you get to the hospital. And one of the functionality of what it does is to collect your information. We are now collecting your information.
Biodata. Okay.
Yeah.
Occupation.
Occupation, Abi?
Okay.
Yes.
Yes.
Yes. Okay.
Some hospital, you don't tell them your occupation. Once you tell them that,
they will charge you plenty.
They will give you big bill.
Exactly. You tell them, say, you be driver.
All right. So,
and we've not written the patient's phone number.
The phone number is not there. Yeah. There should be phone number.
Yeah.
Patient phone number and email address. Patient phone number. Patient's email address. The way we are going, are you sure we are going to finish it today? Email. Oh yeah, you were saying something.
The children, dependents, all those people that depend on the patient.
You are not clear, please.
I said, what about the children under the patient? Dependents or hello, can you hear me?
Yeah, I get it.
I don't. Is it necessary?
Let's leave it this way. Let's make it simple. It will become complex for us to manage. Don't worry. There will be version 2.0. This is version 1.0. Let's look at that one in the next version that we're releasing. Is it working now?
Yes.
Okay. All right, guys. Let me say we've gotten okay. So who is the health medical officer again? Mr. Please, I'm not seeing. All right, Mr. Bashir, what other things does a health record officer does?
Okay, they maintain confidentiality.
I cannot hear you again. I was hearing you before. Hello, sir. Mr. Bashir. Your part is very important.
Can you hear me now?
Yeah, it's better. Thank you.
Yes, they maintain confidentiality.
Confidentiality.
They extract.
Okay, tell me.
Yeah, they extract and analyze hospital and maternity data and statistics.
Okay, let me analyze and what?
They extract and analyze hospital and maternity data.
Hospital
and maternity data and statistics.
Maternity.
By the number of beds, the number of patients.
I get it. That one we can say that we can call it reports. Do you understand? So in IT, you call it reports. That's where they will extract the information we've captured. They will run analytics on it. They will be able to say, we have 100 people with age 1 to 20. We have 2 people with age 100. We have 5 people that is diabetics. We have 20 people that is, do you understand? So we call it reports and analytics. It should be able to view or generate or view reports and analytics. All right, which other ones do you think you should be able to do? Is that all? Mr. Bashir.
No, sir. The 5 processes for discharge.
You said?
Are you there?
Yeah, I'm here.
Okay. Like the process, admission and discharge.
Process.
Admission and discharge.
Admin.
And the 5 patient reports, birth notification, forms, and other
My brain is
verifications.
not that smart like your own. Just be slow with me. You've mentioned processing, admission, and discharge. Oh, yeah, tell me again.
Yes, then the 5 patient's reports, birth notification.
Patient?
The 5 patients files and reports. Then birth notification.
Birth notification.
Yes, birth notification.
Birth notification.
And they also process death notification as well.
What do you call it?
And also death notification.
Death notification. A process birth notification process death notification. Which other one again? Mr. Bashir.
Sir?
You are the head of record officer. Tell us more things that you do.
Okay, finally. Okay, I'm coming. Okay, they participate in preparation of outpatient and inpatient. They participate in preparation of outpatient and inpatient monthly reports.
And that's part of report and analytics.
Okay.
So we'll put all those reports here. We'll put it under this guy. All those reports that is possible that they have, we'll put it here. We can do that one later, but let's stop here. Let's stop here. All right, you've done well. So it means that whenever we are developing this application, we'll be able to, this particular guy, health officer, will be able to take medical record with this kind of form as his input, and we'll be able to see this record, filter, search on this particular record. And then at the end of the day, it will be able to generate some kind of report from the system. One of it is inpatient, outpatient reports, and analytics of the medical record and all those things. Let me just put inpatient, and then I have outpatient here. Outpatient reports. And then if it's processing admission and discharge, you can process admission and discharge, birth and death notification. There will be some form that will be captured here. Births, dates of birth. We have time of birth, time of birth, We have doctor that took the birth. We'll have midwife that took the birth. Midwife that took the birth. We'll have parents of the baby name. Parents of the baby. Name of the parents. Name of the parents of the baby. We'll have it here. And then another thing we should have here is process vessel. What other things do you think we need to record when they have a birth in an hospital? What other things do we need to? And then this baby that they just give birth to will have this information. And then the same thing will always happen to the death too. We'll have date and time, cause of death, then doctor that confirmed the death. Dates. We have date of dates. See what we are doing now. It's called solution analysis. And then some people make living by doing this. Date of death, time. They have time of death. We have the doctor that confirmed the death. That's confirm the deaths. And then which other things do we need to capture?
Nature of death.
Nature.
Cause of death. Cause of death.
Cause of death, have you?
Yes, cause.
Cause of death. Some people didn't come to training today because of the assignments. They think I'm going to ask for assignment. Cause of death. What other things should we capture here? Let's say place of death, but we are not supposed to have place of death, but let's say place of death. All right. So this is the record that this man captured as a health record officer. Thank you, Mr. Bashir. You are owing me 7 Coke. All right. So who did we give patient to? Who did we give patient to? Can anyone hear me?
I think you split that patient.
Please, who did we give patient to?
Patient, no assign it.
We refer the patient to the doctors.
No, we give somebody patient's role that he should tell us what a patient in an hospital management system. Who did we say he should do patient? Or the person has run away? It's paining me that I didn't write.
Sir, did you give me anything?
No, we
Sir?
skip patient.
Did you give me anything, sir?
Medical
I
was
gave you
asking whether-
something now.
I was asking whether you give. I was asking, but nobody answered me, sir.
No, I gave everybody something.
But sir, Abbas,
Yes?
Abbas, but I don't think there'll be any specific role for the patient because the whole system is about the patient. Do you understand?
But patient will do something on the system. For example,
What will he do, sir?
patient can book appointments.
Yes, like this new air, some patients can book. You can check your
Patient can book
health record.
appointments. Patient can make payments.
Yes, and patient can view result of tests.
It can view test reports.
Test report, yeah.
Even before then, sir, patient must complain of what brought him to the hospital.
And that's booking appointments. And book appointment on the system. When you book the appointment, and the nurse will take his vital sign. And then let's just leave these 3 things for patient to be able to do. So it means that if you want to go to an hospital, you can book an appointment ahead of time. Who did I give nurse to?
It's me. Okay.
Oh, income. All right. Let's say a patient comes to the hospital. After he leave the medical health officer, and then this health officer is going to book appointment. Is the one that book appointment or confirm patient appointment. He can confirm or book patient appointment. It could be after payment, and then when this guy comes to the hospital, and then this guy confirm his appointment, and then he will refer him to a nurse. So a nurse now is talking. What do you do in a hospital? What does a nurse do?
Will you refer him to a nurse or to a doctor?
You say you are a nurse now.
I think it's to refer him to the doctor. It's whatever. The doctor now sends him to the nurse.
No. When you go to the hospital, you take vital sign.
Oh, okay. Taking vital signs. Yeah.
Vital. Spell vital, please.
VITAL.
VITAL. Okay. It takes vital sign. And what are the vital signs that it takes?
Blood pressure.
Temperature.
Blood pressure. And sometimes sugar level.
The weight the patients also. Weight.
Let me take it one by one. Don't rush me, please. My brain is not that smart like your own.
Oh.
Yes.
All right, so I have temperature. Temperature. What else again? Weight.
Blood pressure. Okay, weight.
The weight, yes.
Blood pressure.
Yeah.
Pressure. What else again?
Sugar level.
Sugar level. Sugar level. And then it's going to.
Yeah, so.
It gets sugar level and what again?
I think that's all.
It could check oxygen level.
Okay.
Are you?
Then they check oxygen.
No.
They never check oxygen for me.
Then they check them. They will put something on
For
your
some
thumb like
ailments,
this.
they check.
They will put something on your thumb like this and say,
Yeah, sickle cell, asthmatic patients, they can all check heart problem only. Check oxygen.
All right. So if a nurse is checking oxygen level, after checking those things, it will say go to consultant's room 5. What is it doing? It's actually queuing you up, like referring you to a doctor or putting you on a queue. Put on doctor's queue. Ikem, what other things does a nurse does?
He or she administers the drug that the doctor gave the patient.
Is that not what pharmacy does?
Injection.
No.
Pharmacists will dispense.
As in like giving injection.
Pharmacies will dispense, but a nurse will administer.
Nurse
but
administers.
It's like admission there. Or like even injection, she can administer.
All right, so pharmacy nurse administer or give injection. All right, what else does a nurse does?
Educating the patient.
And we can't put educate. How do we add educate to software?
Like there's something, doctors don't have that patient to be, let's say he gave you a drug or something. That is the nurses that will now.
So how do we automate educate patients?
I don't know.
All right. Is there any other one? Think.
Documenting let's say the person was what do you call admitted in the hospital, discharging of the patient or something.
Is it the one that would discharge patient?
No, even without Abbas, is this the nursing? There is inpatient and outpatient. Like those on admission, the nurse will administer the drugs. She record the progress of the patient, for the doctors to come and see. And
we
so
can
the
say you
two
can update medical record.
update medical record.
Medical record.
So you can update patient medical record. I think we can stop there, right?
Yes.
Some people has run away when it's becoming their turn. Now, wow. All right, so we need to talk about doctor. When you leave the patient side, you leave the nurse side, you go to doctor side. So what does a doctor do? Where is the doctor? Oh, this is medical doctor. All right, what does a doctor do? Who did I assign doctor to?
I'm the one.
All right, tell me what a doctor does.
Basically, they do diagnosis and treatments. Basically.
Diagnosis and treatment.
And they make, yes.
How do we put that in software? Diagnosis and treatment.
Yes.
That's difficult to put. Can anybody help us? Okay, if he's diagnosing a patient, he's going to enter the medical.
The doctors would they will diagnose an illness from the patient's medical history. So when they see their medical history and what is.
All right, okay.
Yeah.
So doctor most time will enter the complaint of the patient into the system.
Yeah.
And then they will diagnose. So we say it he enter patient medical record. And then he also diagnosed, enter is diagnosed, what's it diagnosed on the system? Enters
Diagnosis.
record. What else does the doctor do? Doctor can refer you.
Prescribe the
Yes,
drugs.
yes. They also do consultation and referral.
Prescription.
Prescription, drug prescription.
Referral.
They do consultation and referrals.
And
They
do
also
referrals.
refer.
Yes.
Consultation
Yes.
is what they are currently doing now. Why are we saying consultation?
Yeah,
But the
okay,
referral.
referral.
Yes, referral.
Refer. So where do they refer you to?
Maybe to another hospital or maybe to a lab.
Or maybe to a specialist hospital.
And then
they
they can send you to lab for a test. They can send patient to lab.
Yeah.
For
Take that under referrals.
tests.
I think it's under referrals.
Eh?
I think
You
it's
can take it
under
under referral.
yes.
You can take that one under referrals. Yes.
because
Okay.
that's different. We can send you anywhere. Lab, radio, X-ray, dentist.
They can refer you to X-ray, Abby, radiography lab.
Or any department.
Any department in the hospital.
Radiography. Remember, we are developing this thing together. Before you say it's me that puts it like this.
Laboratory.
There is an error. We'll go chop the blame together. They can refer you to lab. Where else they refer a patient to?
Ophthalmology and optician.
They can refer him to a pharmacy, Abby.
Yes.
But that's after drug
That's not
prescription.
They must prescribe drug first.
Yeah,
Prescription.
One is part of diagnosis now.
All right, wait. Let's take it this way. So it means that, let me delete this. Another thing that a doctor does is to prescribe. No. Aja, we can't hear you clearly.
I said what you're trying to capture is the actions the doctor would do, right?
What the doctor will do. So doctor can prescribe.
Yeah.
And he can also view results from lab tests.
That's diagnosis now. That's diagnosis.
Diagnosis is the final
when you refer you to a lab and the report come back, you'll be able to diagnose it. Abi?
Diagnosis is go and put what he has seen, but viewing, he'll go and see, he'll click, then all the lab results, you select which
We'll
one
say
he wants
interpret then. Interpret.
Interpret result.
Interpret result is diagnosis.
It can interpret results, and then it can prescribe medication.
Yes.
And when you prescribe medication, you can send it to lab, to pharmacy, Abi?
To pharmacy, yeah.
You can send it to pharmacy when you prescribe the drug. I hope you are enjoying this session.
Yes, sir.
Yes.
All right, so you can prescribe, and then after I prescribe, Mr. Doctor, who is our doctor again?
Dr. Dami.
I can't hear you clearly. Dr. Damilola, Abi?
Yes.
What other thing can a doctor do?
How do we put operation?
They also do what's it called? I think they are in charge of medical administration.
Send you to another hospital too. You can refer
What
you to
run,
another
Abi?
hospital.
Another hospital.
They can refer you to another
They call it
hospital.
ward run.
Yes. Ward round, yeah.
It can do patient treatment and surgery.
Yeah. They also do outreach, like all these community outreach programs.
Patient
I don't think
treatment.
that's part of
We are not putting that
Yes,
here.
that one has gone out of the hospital.
that one is out of the
environment.
hospital.
Let's stop here before doctor will spoil our shit. No, let us spoil our flow. All right, it's making sense, right?
Yes, sir.
All right, so after a doctor points people to pharmacy or radiology or mortician. So let's talk about pharmacy. So a very simple case, you go to pharmacy. What does the pharmacy do? Who is our pharmacy?
Yeah, your pharmacist is there. Pharmacist T1.
I'm not hearing you. Speak louder.
Pharmacist T1 is here.
All right, tell me what the pharmacy do.
The pharmacy are in charge of dispensing of medications.
Dispense
Yes. Yes.
medication.
Drug
All right.
dispensing.
What other thing does it do?
And they formulate and reformulate dosage forms.
Ah, that one tough. Oh. Can you say it again?
Okay. I said they formulate and reformulate dosage forms. Peradventure, as a patient now that is in critical condition, if the person needs to take double dose to be for a particular period, maybe by the third day, they have to reformulate it. Okay, now that you have been taking 222, let us change it to 1 TDS.
But will it go outside? If in the hospital setting, will it not be outside the doctors? Is the doctor that will actually?
No.
Sometimes
When they work hand in hand, though, without the.
We can't do it without the doctor now. In the hospital setting. Oh.
Yes.
in the hospital setting, the doctor will tell you the
Pharmacies
kind of drug
pounded
you're
the
taking, but
drugs.
the
They
pharmacist
formulate
that will tell you how
drugs.
much to take based on what the doctor
Prescribe.
prescribes. So it's the pharmacist.
So what other things does a pharmacy do?
And they monitor and report the drug safety.
Monitor.
The monitor and reporting of the drug safety.
Pharmacokinetics.
What about reordering drugs?
They are not the one that will reorder. It's the storekeeper.
Oh,
We
yes.
have somebody that will call storekeeper.
But I think the pharmacy will tell this in what and what is.
You know we are automating system now. The system will tell the storekeeper that you need to reorder. Sure, you understand?
But sir, they are in charge of ensuring the supply of medicines that is within the law.
In the hospital.
They will be part of the ordinance.
But we can't put ensure supply.
Yes, yeah.
But we have inventory. Inventory of the drug. So are they the one that will be keeping inventory in our application? If we say they are the one, they are the one. Nobody
So
would.
what they should be doing about, but it will be the ones to figure an order based on quantity they want. Yes, and then the storekeeper will see what has been flagged and then he order.
Okay, we can say that they create stock order, Abi?
Yeah, stock order, yeah. They should be able to figure the order when they need. They should be the ones
So
monitoring.
if they create stock order, the storekeeper will now go and look for those drugs. Abi?
Yes, and the storekeeper will go and buy. He's going to procurement for the.
Read one.
Create reorder one. Create drug reorder quantity or how would
I think I get that. Right?
Figure reorder, yeah.
Yes, sir.
What other thing does a pharmacy do?
Can we include the advice patients about medicines?
And that's the reformulate drugs that you wrote there now.
No, advice to patients is not under reformulate drugs. Sir.
They advise the patient. And we are building a system now.
Okay, you cannot do that on the system.
You can't say advice on that one is Faber talk now. When you give a patient something, you say it, and then it's recorded there because you've already said this is you formulate.
You can add pharmacovigilance.
I can't get that.
No, I've seen monitor and reporting in here. Don't I say pharmacovigilance, but I think you can do that on the monitor and reporting drug safety. Sir.
On the issue of okay, on the issue of expiration of drug, I don't know, how do we put that? I think they are the one in charge.
That's stop keeping. I think it falls under stop keeping, but we can put it here. Expiration of drug. It's supposed to be under inventory.
Okay, let's leave it.
Drug expiration and reordering.
Balancing
all right.
So what about the issue of when the drug was prescribed for the patient, but this drug is not available, but they have to replace it with another one?
That's reformulating now.
Okay.
That's
Yes.
reformulating of drug.
Okay.
So if doctor wrote something, they can change it.
All right.
I think we are getting there. Should we close by
Yes, sir.
6 or we should finish this thing before we close?
Let's move on.
Let's finish
How
it.
many remain?
All right, so let's go to when pharmacy is done. You remember patient, the doctor sent somebody to pharmacy, sent somebody to radiology, and also sent somebody to lab. Let's go to the lab. We mentioned lab technician.
No,
Who is the lab technician?
I think
Let's
we
take lab
mentioned
scientist first.
lab scientists will be.
Let's
They are
check
the
lab
ones doing the
scientist
major work
first.
there.
Abi?
Yes.
All right, what does the lab scientist do? Who is the lab scientist?
I.
All right, tell us, Mr. Abibullah Abdul Wahab.
Yes, sir. You do the testing of blood. First, you collect samples. Sample collection.
Sample collection.
Then the test, to conduct test.
And when you finish, he does test, Abi?
Yes, sir.
And when you finish test, he enters the result of the test, Abi?
Yes, you analyze the test result, interpret or analyze the test result.
He interprets, Abi?
Yes.
He analyzes the test results, don't mind my spelling now. Analyze, interprets. All right. So what other things does it do?
That is the little I know, sir.
That's the only one he does.
That is
This
the
guy
little
is
I know.
enjoying.
I think he enters the result into the system, right?
We'll put it here now. Can you see it?
Okay.
Enter test results, and then he analyze and interpret. What other things does it do?
What is the name called when they are collecting blood from people?
That's sample collection.
The one that store, yes, they
It's
collect
here.
blood.
You can see it here. It collects
Okay.
sample.
No,
Those
this
ones
sample,
are
no, this one is different though.
they're called
Blood
phlebotomies.
donation.
Yes, blood.
It could be anything. Huh?
Okay, you are saying blood donation.
Yes, sir.
That's another department now. There is a department they call blood bank. In the general hospital.
But the lab will have to test whether the blood is okay.
It's those people that will send to lab now. It's not the patient that will go to lab himself.
Okay.
They are collecting blood from you. You have to go there. If you are not from a doctor, you'll be from there. So for now, we didn't mention that guy in the beginning. So there's one lesson in software development. If it's not in the scope, of what you are doing, don't add it to it because it's going to make you work more and more and more. Do you get? All right, let's stop at lab. And then when this guy finish entering the results, interpret the results, and he will send the results to doctor. Forward results to doctor. So you can see the ecosystem. Start from the doctor, comes to this guy. When this guy is done, forward it back to the doctor. Doctor can forward to pharmacy, and it goes on and on and on. So what else does a lab scientist does? Do we say that that's the only thing it does?
So I want to make a suggestion for that forward to doctor.
Tell me.
Like this forward to doctor, what if let me use my own experience. Like you go to the lab, this thing, you just enter it into your own record. So it's not necessarily that you have to see that doctor that you went. Any doctor that opens your record can see the result.
I'm not saying that that particular doctor is one forwarding it to.
Okay.
I'm not saying that it's forwarding it to that particular guy.
Okay.
All right. So, sometimes you need to forward the reports to the patient that does the test. We can forward the report to patient too, isn't it? Guys, talk to me now.
In Nigerian hospital.
Oh, in Nigeria, we don't do it. Oh.
All right, let's put it there. Let's put it there. They can
Seriously.
report it better.
They even say this file is not even allowed for family and comfort.
You will not even know what's going on.
All right, who did
You
we
know,
give
right?
radiography to?
Now me.
All right, tell us what a radiographer does.
He take imaging,
Sir?
diagnose and treat illnesses, then review various imaging tools.
You are far away from your microphone.
They were physicians who specialize in using medical imaging to diagnose and treat illnesses.
My mama, you are reading it for us.
No, I'm not even reading. No, I don't come up.
Oh yeah, tell us what he does now. Just tell us 1, 2, 3.
Okay, one, they review imaging.
They take
e.g.,
image.
e.g., MRI, CT scans, and X-rays. They were the one that.
That's taking the image, Abby.
Yes.
Abby?
Yes.
They can review the image, Abby.
Yes. Exactly. And they provide interpretation to the images.
When they review the image, they interpret and forward to doctor. And they forward to doctor.
Exactly.
Forward to doctor or patient. All right, which other one again?
Okay.
I think we've covered the part that I want to cover, except for the finance parts. Most of the things we need to cover, we'll cover it. Then the storekeeper, it takes, who is the storekeeper? Who is the storekeeper?
Maybe it's not around.
The storekeeper has run away. I hope you leave the key of the store. Can somebody tell me what the storekeeper do? It does drugs and medication.
Records,
Keep
drugs.
inventory of materials.
Inventory. It keeps
Drugs
the
and
Materials and I think office. I say office, church. I say what am I saying? Hospital equipment.
Hospital equipment inventory. What other one again?
Procurement of
Procurement. And then you receive inventory, have it?
yeah.
You receive inventory. You also keep record of reorder level. It keeps the reorder level and all those things. So what other departments? What other things? Who did I give lab technician to? Who did I give accountant to?
Hi, sir.
Accountant, right?
No, I'm the
Yes,
auditor.
sir.
I'm the auditor.
Okay.
the
Oh, yeah, tell me, what does an accountant do in an hospital?
accountant collect payment for service performed on patients.
He collects what?
Payment for service performed on patients.
Let me say payment collection.
Payment collection.
Tell me more.
Then it's also the officer that will analyze accounting data, prepare report.
He prepare reports, financial report. Let's say financial report.
Then track financial documents.
It does track financial documents.
Then reconcile account statement or book. I don't know how to put it here.
Account statement. What other things does it do?
Then it's also involved in what is it called this in managing the financial aspect of the hospital.
All these things are managing finance.
Budgetary.
That's forecast and budgets.
Budget, okay.
A forecast or budgets, hospital expenses. What other things does it do?
Okay.
How about payment voucher?
What does payment voucher mean?
For instance, like you said
That's paying suppliers.
like when they supply them goods, pay voucher for their supply.
Paying supplier.
Yeah, they create the voucher already.
All right, it does voucher creation. Voucher.
Voucher, yeah.
Is there another thing that an accountant does?
What about when you analyze the hospital costs, identify area of inefficiency?
Say that again.
As in, you can also analyze and identify area of inefficiency. When it comes to
That's a
That is the work
skills.
of the auditor.
That's a skills. We can't put it. Yeah.
That's even work of auditor, medical auditor.
Auditor's work.
But you know, sometimes some people mix finance with auditing. All right, let's stop there. The time has gone. Who else is on the call that I give something to that he has not talked? Talk
You
now.
gave me auditor.
All right, let's go to
Auditor.
auditor. What does an auditor do?
Investigating medical service providers to ensure they meet all legal requirements.
Investigate medical supply. All right, so let's put it like he's going to confirm storekeeper supply. Let's just put it that way, so that we'll make him a kind of validator to whatever they are entering inside the medical record.
System. Okay.
Validate medical.
Check the work of the medical coders and billers.
Ma?
He also checked the work of the medical coders and billers.
If vet what?
Check the work of medical coders and billers.
I don't know that word though. Can you
Who are
spell it?
coders, please?
Coders, just like coding. You know, all these the medical things, they code them. So he makes sure that the codes are done properly.
Okay.
Okay.
Medical items like drugs, have it?
Yes, medical codes, different codes, and billers, like you make sure that all
Okay,
the
check the suppliers of goods and ensure that they are in order, have it?
yes, everything. And the initial codes that they create, sometimes let's say if they want to add new codes to the system, that he makes sure that they're following the due process, that everything is as
All
it
right,
should. They're following.
let's get more.
And then identify fraudulent claims.
It does audits.
Outlet.
It does audits
Yes,
on the system audits.
yeah. And he checks inefficiencies and
I'm
poor
looking at
documentation.
system functional stuff.
He checks outliers, if there's anything
And that's
unusual.
auditing now, have you?
Okay,
We can stop there, right?
yeah, that's okay.
All right. So what other ones? Who else has his own role that I've not talked about?
ICT.
ICT. Oh, what does ICT do?
Everything we've been doing since morning.
So what have we been doing?
Oh my God.
Wow.
What
It's
have we
actually
been
correct.
Eh?
They
It's
maintain
actually
and
correct.
update computer system.
They maintain
It's the one that will digitalize everything now.
And update computer system.
No.
Yeah,
And
tell
make
me
sure
more,
that
tell me more.
there is
I should tell they
24 hours
troubleshoot technical
internet.
issues.
They troubleshoot.
Technical issues.
Okay, tell me more.
Okay. This one, yeah, I think is, I don't know, training of staff on how to use technology. That one is.
All right, so they set up the system. Set up
They assign roles.
system.
Assign roles.
They assign roles, correct. They assign roles to users. Assign roles. Abi?
Yes, sir.
What
Yes,
else
sir.
did they do?
I think they should be in charge of
Sir?
what is and there are some materials they usually give to patients in the hospitals. That should be under the ICT, like
What
developing
material?
educational materials for patients.
What do you call it? Education material?
Educational materials.
How do we use a system to do that? What functionality are we going to call it on the system?
The ICT does not really actually need System to configuration.
I've put it here, setup. I put something set up here. System
Why did you
setup.
put the setup?
Assign role.
Okay. Hello, sir.
They take backup of the system.
And then what we are actually
Backup
doing
and restore.
currently, they will recommend new technology systems, like just something we are doing.
Backup and restore.
Review.
And restore. Restore.
Okay, backup and restore. Okay, I didn't hear that.
That's evaluation and assessment.
Review. They review and evaluate, have it?
Yes, evaluation and assessment. I mean, assessment and evaluation, whatever. Yeah.
See, almost everybody here, they are in the area of ICT. If somebody say that, why are you important in this system? We did not see any role to assign to ICT here. Can you imagine?
Well, the major role is like they should provide support now.
That's it
People
now.
should
But
be able to
support is
log
not on the
calls.
support is not functional.
Yeah, it's not functional. Actually.
It's not functional. All right, we are good like that. So who
How
else
about
has
the how about
yeah?
the DBMS?
Is that?
DBMS.
But in the system, they
Yes.
should be able to log call now if they have problem, so the IT will come and repair.
That's support, Abi.
Mm.
The ICT is in charge of the database management system.
That's why we put backup and restore there. What they are backing up is database, and what they are restoring is database. Oh, this our software is rich. Oh. I'm glad we all participated. Though. Okay, who else has not talked, please?
Works.
Works. Oh yeah, tell us. What does works do?
Works, no be works.
Who is works? Who is works?
Works is it driver, cleaner, and co?
See, let's leave those parts. Let's leave those parts. So these are the core functionality we'll be building in this application. You can see that it's very complex. So be ready to
the CMD.
CMD. Let's leave those
Medical director.
the core functionality we've taken care of.
That one admin.
So they will be able to do most of all the things that every other person is doing. You were saying something. Your network is bad in case if you are talking. Can anyone hear me?
Yeah, I can hear you.
I think we are good at this point. So if you have opportunity to analyze a system, this is the best way to go about it. And then later you take each and every one of these things that needs to be broken down into smaller particles. And then dispense drug, how do we dispense drug? It will be a process. And then you say formulate drugs, it will be a process. And then at high level, we're able to break this thing down. If you have any question, let me know so that we can close the class and then we'll meet again on Saturday.
Abbas, you know this
You said? I cannot hear you. You are not loud. Yes?
UI UX, before you said you're going to do a recap for some of us.
Let's see how it goes. He said there is a class on Saturday. I'll tell him to start with a recap and then move upward. So all these things that we are looking at is the UI UX guy that will develop the prototype that will look like a ready-made software for us. And then the front-end developer will pick it from there. And then they will be able to develop, and the back-end developer will pick their own from there too and be able to develop. So let's meet again on Saturday and then work together again to build a very beautiful application that will make the future hospital management system. Thank you very much and have a wonderful, enjoy the remaining part of the day.
Thank you, sir.
All right, thank you.